This lumbar spine manipulation is called the Chicago technique. It's also known as the SI regional technique. Sometimes it's been called the shotgun technique. And it's been called the shotgun technique because it's known as a manipulation that's not very specific at all. This manipulation can get anywhere between L1-2 to down to the SI joint. So shotgun meaning you shoot, it hits everything. So we try to make it a little more specific than that by using some very specific locking techniques. And by locking, what we mean is that we're moving the other spinal segments that we don't want to move to points where they cannot move any further. The idea being to try and get our forces localized as much down to the position where we want to actually manipulate as possible. So the preparatory movements here is what I'm going to ask Travis to do is just to bring his shoulders across. And then we'll also cross the legs and bring the legs across. And then we'll shift the butt over as much as we can to get a C shape, a banana shape, away from us. I'll then ask the patient to put, Travis to put his hands behind his head. And then we're going to be bringing into a rotation technique here in an effort to lock up the lumbar spine so that we can manipulate through the anterior superior iliac spine. Now what's very important here is that when we perform the rotations that we don't bring any side flexion in. As soon as we bring the side flexion back in, we're going to lose the ability to lock the spine early, and Travis is going to rotate far more than we really want him to do. So the way I do this is to pull up the shoulder and to reach right under as far back towards the shoulder blade as you can. And then imagine a spit of an axis going straight down through his thorax, and it's a lift up straight into rotation only. And then a point where you start to feel the ASIS come up off the bed is where our end feel is. Now you can see here that Travis is locked up nice and tightly. I can get to the end feel here. I'll ask him for his consent to do the procedure. I'm just going to do a quick movement at end range. Are you okay with that? Yep. Get to the pre-manipulated hold again for a second, and then the thrust comes down straight through my right arm, like so. And that's how the technique would be done. Can then lower him down, reset everything, and then we would reassess to see exactly how effective the technique was. That technique can get a large crack. It may not be any noise at all. In this case, there was not any noise at all, but it's not uncommon to get quite a large crack or a series of cracks.